Hi, Professor Chris and cohort. My name is Melissa Meadows. I'm an FNP student taking 597, and I'm going to give you my oral presentation on my most recent SOAP note. This is going to be my signature assignment. Most recently, I've been working in a pediatric clinic located in Miami, Florida. And the patient presentation that I'm going to discuss today is a really interesting one because I had never seen this in my practice before. And now that I've been exposed to it, you're absolutely, and at the end of this, you're going to understand how to better identify what this patient is presenting with. So we have a 13-month-old, okay, African-American female presenting to the clinic for a physical assessment for cough and fever. Her mother is present and speaking on behalf of the child. She states that her daughter has been coughing for the last 2 days. Mother states that she's had a fever with a rectal temp of 101.6. She states that she has not given her any fever reducers such as Tylenol, ibuprofen, because out of fear of overdosing her child since she is only 13 months. So she brought her to clinic today to make sure that she got a physical assessment so we could help guide her. She reports using both albuterol and budesonide as prescribed to reduce, cough symptoms and help the patient breathe a little bit better, but says that it's not providing a ton of relief right now. She reports that the child is up to date on all vaccines and that the child does have a past medical history of bronchiolitis, pneumonia, back in January of this past year. Her past medical history, other than that, is atelectasis, GE reflux, patent ductus arteriosus, patent foramen ovale, and esophageal stricture that was congenital. She was born with that. Her surgical history was hospitalization for bronchiolitis and pneumonia this past January of 2020, but then denies any other past surgical history. The current medication she is on is albuterol 0.63 milligrams and budesonide 0.25 milligrams. No known drug allergies at this time. Past family history is mother is 30, denies any past medical history. Father is 31, but unknown past medical history for him. He's not in the picture. The maternal grandfather is living 50, hypertension, type 2 diabetes. Maternal grandmother is living 50 with hypercholesteremia. Now, the paternal grandmother or grandfather, again, are not in the picture, so no known etiology there. Okay, no siblings at this time. Vaccinations are up to date. Patient does not attend school or daycare. Grandmother actually watches the child when mother works Monday through Friday, 9 to 5. Lives in 2-bedroom, 2-bath with maternal mother and grandmother. She shares a room with her mother. The family life otherwise is stable and unremarkable. Now let's get into review of systems. No weight change, weakness, fever present, 2 days, highest rectal temp was 101.6, denies chest pain, shortness of breath, heart palpitations, denies visual change, double vision, blurred vision, blindness. Denies hearing changes, tinnitus, pain, or discharge. Denies chest pain, tenderness, and palpitation. Denies shortness of breath. Patient denies dyspnea. Mother does report barking like cough, constant for the last 2 days. That is non-productive. Denies change in bowel movements. Reports no abdominal pain or blood in stool. Reports no change of urinary frequency, dysuria. No swelling in the extremities. Patient denies headache. Let's move on. This video can only be 10 minutes long. Vital signs, that'll all be in my written report. Her temperature was 101.2 in office. Respiratory rate was 25. Pulse rate 118, weight is 20.2 illables. Based on my physical assessment here, is a patient appears well-groomed, well-nourished, appropriate for size. Natural in skin, warm color, smooth and dry skin. Pupils are round, reactive to light. Normal cephalic head. Basically, I'm going to give you the most pertinent things, okay? Her tonsils are a grade 2, which means occupies 55% or 50% of her pharyngeal space. Cardiovascular, normal rate and rhythm. I heard no murmur. Her radial and femoral arteries palpated within normal limits. Pulmonary was breath sounds are equal, stride or bilaterally present, no rhonchi or wheezing. Neuro, alert and oriented, psych, cooperative, mood, appropriate. So let's get into the differential diagnosis that I came up with her. First and foremost, acute obstructive laryngitis, which is croup. Okay, as evidenced by loud barking cough and fever. That's typically worse at night. The second differential was acute bronchiolitis due to RSV, as evidenced by persistent cough and stridor. The third was her congenital stenosis and stricture of esophagus. I was thinking that that could just be an exacerbation of that underlying issue. And that's as evidenced by her past medical history and coughing. Now, I want to give you an idea of what stridor sounds like.